One of the biggest mistakes I see in my clinic is not wrong diagnosis, it is delayed attention. A patient develops low-grade fever, not very high, just enough to feel tired. They take a few medications, the fever improves, then comes back. A few days later, the same thing happens again. Weeks pass, then another symptom appears. Night sweats. Not ordinary sweating, I'm talking about waking up with clothes completely soaked. Sometimes even the bed sheets need changing. Yet many people continue to tell themselves it's probably the weather, it's probably stress, it's probably a viral infection. Sometimes they are right, but sometimes they are not. And that's what I want to discuss today. I'm Dr. Ganesh Jaishetwar, Senior Consultant Hematologist and Bone Marrow Transplant Specialist. Let's talk about when persistent fever and night sweats deserve medical attention. First, let's be clear. Most fevers are not cancer. Most fevers are caused by infections, viruses, bacteria, seasonal illnesses, and most of them resolve without major concern. So this video is not meant to create fear. It is meant to create awareness. The question is not, do we have a fever? The question is, what kind of fever are you having? As hematologists, we pay close attention to patterns. One pattern that concerns us is a fever that persists beyond 2 weeks without clear explanation, especially when it keeps returning despite treatment. Another pattern is fever accompanied by drenching night sweats. Patients often describe it like this: Doctor, I wake up in the middle of the night completely wet. Doctor, I need to change my shirt. Doctor, this has never happened before. This is different from feeling slightly warm on a summer night. And when these symptoms occur together, we start asking important questions. Why? Because persistent fever and night sweats can occasionally be sign of underlying blood disorders or systemic diseases. One condition many people have heard is lymphoma. Lymphoma is a cancer that affects the lymphatic system, which is part of our immune network. One of the classical symptom patterns seen in lymphoma is persistent fever, drenching night sweats, unexplained weight loss. In medicine, we offer these as B symptoms. Now, here is something very important. Having these symptoms does not automatically mean lymphoma. Not at all. Many infections can produce similar symptoms. Autoimmune diseases can produce similar symptoms. Other medical conditions can produce similar symptoms. That's why self-diagnosis is dangerous. The goal is not to assume the worst. The goal is to investigate appropriately. So when should you seek medical attention? I would recommend a proper evaluation if your fever has persisted for more than 2 weeks, if you are experiencing repeated night sweats, if you are losing weight without trying, you notice enlarged lymph nodes in the neck, armpit or groin, if you feel unusually fatigued, something simply doesn't feel right. One of the advantages we have today is that many important clues can be identified by clinical examination and basic laboratory investigations. A complete blood count, inflammatory markers, imaging when necessary, and occasionally more sophisticated investigations. The earlier we identify the causes, the better we address it. Now let me tell you something I often tell to all my patients. Your body is usually very good of communication. The challenge is that you are not listening. A persistent symptom is often your body's way of asking for attention, not panic, attention. And that is a big difference. If you have had an unexplained fever for several weeks, if night sweats are becoming frequent and you are losing weight without explanation, get evaluated. Most causes turn out to be treatable, and if something more serious is present, early diagnosis gives us the greatest opportunity to treat effectively. Remember, the purpose of awareness is not fever, it is action. Because earlier we understand what's happening, the more options visually we have. If you found this video helpful, share it with your friends and families. Someone may be ignoring symptoms that deserve attention. Thank you for watching. Take care of your health, and I will see you in the next video.